Good afternoon, everyone. I'm Catherine Brookman, Associate Director, Knowledge Transfer and Exchange, and on behalf of Dr. Jack Callaghan, Director of the Center of Research Expertise for the Prevention of Musculoskeletal Disorders, or CRE-MSD as we are more commonly known, we'd like to thank you for joining us today for this free webinar, The Space Between Sitting and Standing, Hybrid Seating, Is the Juice Worth the Squeeze? We are grateful to the Ministry of Labor, Immigration, Training and Skills Development for our funding, which supports the delivery of these webinars, and to our presenters who provide their expertise. We ask that you keep yourself muted for the duration of the webinar as a courtesy to the presenters and all participants. The format of today's webinar is as follows. The presentation will be given, after which time we will have 10 to 15 minutes for a question and answer period with our presenter. During the question and answer period, we ask that you type your questions into the chat box. The chat box can be pulled up on your screen by selecting the chat icon in the control panel that appears near the bottom of your screen. I will relay these questions to the presenter or a similar question should we have duplicate themes. If you have a pressing question or issue, such as a technology glitch that cannot wait until the end of the presentation, please type this into the chat box and we will do our best to address it right away. This webinar will be recorded, with the recording being made available to you on our website, along with the presenter slides shortly after today's webinar. You will also be sent a link to an evaluation. Please fill this evaluation out, as it will assist us in the future delivery and planning of our webinars. Thank you so much for joining us today, and remember to watch the CRE-MSD website and the MSD prevention site for other upcoming events and resources. Now it is my pleasure to introduce to you our presenter, Dr. Jack Callaghan. Dr. Jack Callaghan holds the rank of Professor in the Faculty of Health at the University of Waterloo. He is the Director of CRE-MSD and holds the Canada Research Chair in Spine Biomechanics and Injury Prevention. Dr. Callaghan is a Canadian Certified Professional Ergonomist, is cross-appointed to Mechanical and Mechatronics Engineering, and received the Career Award from the Canadian Society for Biomechanics in 2014. His research is concerned with the etiology of spine injuries at the tissue level from exposure to cumulative loading scenarios, and has been funded by NSERC, CIHR, and the Ontario Ministry of Labour, Immigration, Training and Skills Development. He has collaborated and consulted with a wide range of industrial partners, including automotive and office furniture manufacturing companies. He is the president of the Canadian Society of Biomechanics and was inducted as a fellow in the Canadian Academy of Health Sciences in 2021. Thank you so much, Jack, for joining us today, and we look forward to your presentation. Over to you.
Yeah, thank you very much, Catherine. Make sure my slides working here. There we go. Okay. Thank you to everybody, CRE-MSD, our staff, Catherine, Bettina, and Kim, for hosting this series related to office work and workstations. And I'd thank all our members of the community for registering and attending. As always, as Catherine said, we have resources. If you have any requests for other webinars, conference topics, or guideline resources, please feel free to reach out to the center. So what I'm going to be talking about today is a fairly new area that's been expanding. So the question is, what is hybrid sitting? And it's really the space between sitting and standing. So that's where the title comes from. And you see a picture of it on the top left of my slide over here, where the trunk to thigh angle is greater than 90 degrees that we typically see in sitting, but less than 180 degrees that we see in standing. So today I'm going to cover why this is becoming a market area, the foundation behind the idea in the first place of having this hybrid sitting position. We're going to go through a lot of the research looking at this posture and the impact on seated workers, and then finally, does it translate into practice? Since this is a relatively new area, much of the research I'm going to show you is very current, and some of it has been submitted from my lab for publication, and some of it is just off the table, so to speak. Last thing I want to address before I leave this title slide, the quote there, I thought of this while sitting on my motorbike, in no way tries to equalize me with Einstein, if you know where the original quote comes from. But you'll see later in the slide why this links back to the same posture of sitting on a motorcycle and this angle between the thigh and the trunk. Okay, so this all really started back in the mid 2010s, where media picked up on this association between sitting and all-cause mortality or cardiovascular disease. And so you've seen all of this, it's still going on today. And where that came from is a study that was published in 2009. And what it showed was that if you spent almost all of your time sitting, then your chance of dying was higher, to paraphrase this study. And the less time you spent sitting, the greater your chance of survival was. So that led into this idea that people should be standing, right? Your chance of dying went down. There were some issues with analysis in this study, and it led to a follow-up paper that was released 5 years later, where they addressed some of the covariates that weren't covered in the first publication. So things like age, surprisingly, if you're older, you tend to die sooner, smoking, covariate alcohol, and physical activity level. So when they reanalyzed this, there was, there was still something present between almost none of the time standing. So they flipped it a little bit. So if you're not standing, you're sitting, okay? And almost all of the time sitting. So this is another flip scale where it's mortality rate, or the number of people that are dying normalized to per 10,000 person years. So what came out of this when they corrected for some of these factors was in men, there was actually no association with increasing sitting and all-cause mortality. There was a strong association with obesity. So if you sat more, for men, the chance of being obese was higher. In women, there was still a trend, significant trend, that if they spent almost all their time sitting, their chance of dying was higher. So clearly something's going on between sitting and our health status. Close after that, about 6 years ago now, Peter Smith from IWH in Toronto, so here in Ontario, published this study looking at a large number of Ontario workers over a 12-year follow-up period, and essentially found the inverse findings, that the more you stood, the greater your chance was of having heart disease compared to a sitting job. Okay, so polar opposites. This is nicely tied to some fundamental research I won't get into, that standing alters the carotid artery thickness and some other factors. Prior to that paper coming out, there were already workers essentially demanding that they wanted to be able to sit down on the job when they were predominantly standing. And that went all the way to state courts, Supreme Courts taking a stand and ordering that these workers had to be accommodated. And so that was back in about 2016. So if we pause here for a second, sitting seems to have something bad going on with it. Standing has something bad going on with it. So where to from here? As you no doubt know, sit to stand or height adjustable tables and job or posture rotation really became a mainstream workstation approach in offices tied to these issues. There were pros and cons to this, and I've given talks on this topic before, you may have seen, and we'll touch on a little here, but the focus is going to really be about hybrid sitting. Another approach that gained footing at the same time was hybrid postures, but it hasn't taken off quite as fast as height adjustable tables. And that's what I'm going to focus on today. So just to bring that little intro to a summation, and if you want, these slides will be available after the talk, so don't worry about trying to get all these things down because I'm going to go through them quickly. So if we look at sitting and standing and sit to stand, what do we know as of essentially today based on the published literature? Well, total sitting time is associated with increases in cardiovascular disease. But if we look at occupational sitting time alone, it doesn't. So we really need what people are doing outside of work combined with occupational sitting to link it to all-cause mortality. In comparison, we know standing at work, so just in isolation, is linked to increases in cardiovascular disease. Occupational physical activity, so you can think of things like treadmill desks, the bicycling things that go under desks, have not been shown to decrease cardiovascular disease. There's no evidence that sit-to-stand workstations, when used, decrease cardiovascular disease. And the metabolic changes with standing is inadequate to decrease BMI. So you're not going to lose weight by simply standing at a desk instead of sitting. We look back into the low back world, which I would argue is the most important thing to look at. Not that I'm biased or anything, but standing is strongly associated with low back problems. We knew this before this reaction to sitting came out. There were ergonomic standards on standing exposure time. Sitting has weak evidence linking exposure with low back problems, but there is some. And sit-to-stand workstations have been shown to decrease low back problems. Okay, so there's a summation of office work and standing, sitting, and sit-to-stand where we sit currently. So hybrid sitting, what you're seeing in the animation is that's a sitting posture where the pelvis rotates backwards, the spine flexes to accommodate a vertical trunk. And that's a standing posture. So it'll rotate between standing and sitting with a more vertical or even anteriorly rotated pelvis and a lordotic spine posture. In 1953, a paper was published that came out with this idea that a 135-degree angle between the thigh and the trunk was a balanced position where the muscle or the tissues on either side of the body were in balance at 135 degrees. So that was viewed as a beneficial posture to be in. And that links back to this idea of these hybrid postures where we're trying to open this trunk to thigh angle. The whole concept behind this is like the snake toys we used to play with, or I used to play with as a kid, where if you move the pelvis, the spine will follow. And that's the underlying theory here, that if we drive from the thigh and the hip into the pelvis, the lumbar spine will change just like the head of this snake moves if you move the tail of it. Okay. So this study was first published originally in 1953. So 70 years ago this year. As I mentioned, it's a position of equilibrium for the muscles across the hip and trunk. It was based on 4 subjects, and the 135-degree measure really came predominantly from one subject with the initials JK, which happens to be the initials of the author of the paper. In defense of this, it's been around, a lot of people talk about it. It has produced some favorable findings. One MRI study by Alexander et al. In 2007 showed that if you get people in this posture, it equalizes the intervertebral disc and you don't get the same changes you see with creep and deformation of the disc in sitting. But also to put in context, there are no studies like the ones we've talked about with sitting and standing associating low back pain or health outcomes that have looked at this posture over a period of time. So very limited number of subjects. The other point I didn't raise was the reference posture is D that you see up here, and that's what they called normal. So it's a side lying posture where you're lying on your side and you kind of find your comfortable position, and they determined that was 135 degrees. And this was the spine posture from X-ray. So you see when I'm standing, it's more extended, and any sitting posture I go into is more flexed or a loss of lordosis. Sorry. Okay. So we have this extended posture in standing, a flexed posture in sitting. We know sitting creates higher passive load in the tissues and joints, laxity changes due to creep in the structures, and alteration of muscle responses. So there's another factor here, even if this balanced position, it can offload those tissues that we load in sitting. This is also growing from a legislative standpoint. I tried to check again this morning. I still don't see that the new ANSI HFES 100 has been released. I've been working on the draft since before COVID. I've been talking to the people, but they now have definitions of these hybrid positions. They're quite good. I'm not saying these will be the final ones, but they're still working on them. And they essentially go from leaning, which here, so you're really standing, just offloading some weight, to a perch where more of your weight is supported with the seat, to a high chair, which is really just an elevated sitting position, to a prop. Okay, so there's defined definitions coming so that we're not just lumping all of these together into hybrid sitting. If anybody knows that it's coming out or has seen a more recent draft, I'd love to hear from you. So I've seen a lot of these in my lab, as I mentioned, really mid-2010s, they started to creep out and they've been growing. Some of them have disappeared. There's new ones coming all the time. And they all target the same idea, that you're moving people into this middle real estate between sitting and standing. To give you how current these are, this was an award winner at NeoCon, which is a furniture showcase in the office furniture world that's held every year in Chicago. And the product was produced by Howarth. You can see that they've opened the trunk, sorry, cursor on the screen, trunk to thigh angle by elevating the seat pan. So this is really just a standard chair that's moved higher with more seat pan rotation to accommodate this open hip angle. Some of the things we're going to talk about is what happens with the pelvis when we do this and how does the load get transferred from the seat pan and into the feet. So where we started with this in the lab was really just looking at when postures differed from sitting and standing in this space between fully sitting or 90 degrees trunk to thigh to all the way to standing, which is 180 degrees or a straight line between our thigh and our trunk. So we incremented people in 5-degree angles of trunk to thigh, looked at muscle responses, kinematics of the joints, lumbar spine and pelvis, and forces under the feet. And this was published in 2019. So some of this was a little surprise because I will admit, maybe there's too many people to admit this, but I'll admit that I bought into this. Like I really got into this wooden snake idea that if we move the pelvis, we will control the lumbar spine, and this is a way to drive better postures in sitting. But what you see on the screen here, I'll find my cursor. So we're starting in sitting and going across here to standing. And this is our male, female, blue and red. And we know females sit in a different posture than males. They tend to have a more anteriorly rotated pelvis than males. But as we increased up to 130 degrees, the pelvis actually rotated further back. It didn't go forward. And the only position that showed a significant difference from sitting was actually standing. Okay, you can see these are really pretty flat. There's a little blip here where females are significantly more posturally rotated, so not the direction we wanted, even though it's significantly different, it's, let's say, worse. And then if we look at lumbar spine, which this pelvis should drive, we see the same thing, right? That they actually become a little more flexed as we raise them up. And the only significant point when they get different for males was around 145 degrees, so well beyond this 135, and females were out to 160 to 175. So those are where the lumbar spine postures become different than sitting. So what else is going on here? There's a huge demand on the legs to support this. So once we cross right into around the 135 degree mark, we heavily recruit the vastus medialis or quadricep group to hold us in the chair. And this is evidenced with shear forces under the feet or horizontal forces and a decrease in the vertical force. So we're transferring force from the seat pan onto our legs in both vertical and horizontal directions to hold us into the seat. So a lot of data there, and there's even more than what I showed. We then took an approach of trying to say what is favorable and not favorable. So higher EMG in the legs is viewed as not favorable. So you can see that here, the green, as it got higher EMG, that was less favorable. The same with shear forces in the feet. A more neutral pelvis angle was viewed as more favorable, and lumbar spine should be in there as well. And then when you put all those together and weigh them out, you can see that anywhere in this hybrid range from about 115 to 170 degrees came out as not favorable because of the demands. Gives us a window of 90 to about 115 where we saw favorable responses, and 170 to 180 are very close to standing. And then subjectively, the people that did it, you can see their lowest comfort or desired postures were the hybrid positions. They got the worst rating for preference. People preferred to stand most, or sorry, sit most, stand next, and anything in the middle was ranked lower. To bring in some external studies here, this bottom one is from Bill Maris's lab at Ohio State. This is from Julie Cote's lab at McGill. And they both showed very similar things where the discomfort was lowest in sitting in Bill's study, highest in standing, and in between here in perching. They had them for much longer periods of time. So there's a duration factor here as well. And Julie showed that this sit to stand or hybrid seating posture, they called it sit stand. They weren't rotating sit stand. It was a in between posture of sitting and standing, had higher reports of low back pain than standing, and they tied it back to muscle activity changes where there was higher demand in this perched position. So what we found represented other people doing studies with people in this perched or middle position. So then we started looking at if you change the way they're interfacing with the seat, can we fix some of these problems? So this was looking at seat pan design and trying to hold them in the seat and offload the feet and some of the physical demand of being in these hybrid positions. So narrowed down a little bit, we only went up to 135. So we're trying to look at that front end where we saw some favorable response in increasing from 90 degrees trunk to thigh angle. And again, measured kinematics, ground reaction, seat pan forces, and I don't think we did muscle activity in this one. So still saw a very similar response where we didn't see a big change in the pelvis, didn't see any real change in the lumbar spine over the ranges we looked at. What we did see is it fixed or it moved the lumbar spine into a bit of a more beneficial posture than the flat, but that was right out from the gun. So in other words, we're pushing the pelvis with the shaped seat pan into a better position that created less lumbar flexion, less lumbar flexion than in the flatter seat pan from the first study. But our user experience still had very high levels of discomfort when we got them into that open trunk to thigh angle. Okay. But so what? Those are very short duration exposures. Looking at demand, did it make any difference at all? So when we do this favorable, non-favorable calculation again over the range that we looked at, we saw with the shape pan, we can actually push it out a little farther. So now we have a usable range up to about 125 degrees. And this is starting to get picked up by other studies and design companies trying to develop new products. Is there anything else I want to say here? Oh, yeah. So, and part of it, we also reduced the shear on the feet. So we were capable of offloading some of the foot loading, where here it was 20% of body weight in shear, and here it's now reduced down to about 10. So we're reducing it by a factor of about a half. So that is right here. This is the original study, and then this is with the shaped seat pan. So then obviously as practitioners, we all want to know, does it make a difference when people actually use these chairs? So we set up quite a big study where they came in every day for 5 days in a row and performed 2 hours of desk work in 5 different conditions. So every day was a different condition, randomized, all of the good scientific stuff there. And it had 2 standard office ergonomics chairs that are commercially available, a standing 2-hour period, excuse me, and this hybrid chair that we've been looking at with an open trunk to thigh angle selected by the person. And the nice thing with the chair is it can accommodate a sitting traditional posture as well. So they were exposed to all those, did standardized tests so we could look at performance or productivity, and they were allowed to accommodate and self-select their posture. We put them in that bin that we had shown from, 90 to 125, but 90 was in the low setting. So we really wanted to try and force them into the upper setting. And so they had a range they could pick between 105 and 125 degrees. And you can see most people pick something in the middle of that around 110 degrees. So what did it do? I will say not a lot. If you look at these graphs, we're looking at the pelvis angle on the left. Again, the reference chairs are commercially available chairs. The goal is to try and keep posture closer to what it is in standing, which is anteriorly rotated or forward tilt. When we sit, it goes into a backward tilt. And you can see that one of our reference chairs actually produced the pelvis posture closest to a neutral or standing position. The high position, which is opening that trunk to thigh angle, in theory should have created the most the position closest to standing, and it didn't, right? You can see this for both males and females. It actually had close to the highest pelvis rotation. We look at the lumbar spine, it didn't translate up there either, that they were all pretty close to each other. The reference chair number 2, again, had the least lumbar spine flexion in sitting. So even though we opened this hip angle, it didn't change the lumbar spine over 2 hours of working condition. So how does the usage in a real world, I'm doing quotations, you can't see me, but it's in a lab, but it's simulated work where they're allowed to move freely inside the chair for 2 hours versus our study 1 and study 2 where they were just constrained into postures for us to look at the response. So how does their performance in here link back to those 2 studies? What's circled on the left of your screen is the range that we looked at in the study. So remember 105 to about 125. So this is what we saw in the study. And I've just taken the average angle from these curves of 110 to represent what was picked by the users. You can see that in the hybrid usage, it really fell directly in line with what we saw. Lumbar spine was a little bit better when they were using it for office work than what we saw, but we're not seeing a marked improvement due to opening this trunk to thigh angle. No change in productivity at all. It was flat across all 5 conditions, so it's not making them worse or better. And that's the graph on the right here. And then this is discomfort. So coming back to the user perception of using these hybrid devices, on your left you have females, on the right is males, and there's a different response here between the 2 sexes, where females actually preferred hybrid high. So even though we didn't dramatically change their posture, they liked that position. It's red on this graph, and you can see hybrid low, they didn't like at all in that chair. Our reference chair green was performed well, and red got better over the 2-hour period. So from a comfort perspective, females liked the high open position. Males did not. It was the exact opposite. They had lower discomfort in the hybrid low, and the highest discomfort approaching standing levels when the chair was open in the high position. So very different sex response there. And then we started thinking, is it a movement factor? Like, are people moving more in the chair? Maybe their actual posture isn't different, but this is two measures we use to look at how people dynamically move over time. It's fidgets, so moving around a position, and shifts is adopting a new change to position. You can see there's really no trend here at all. Doesn't matter what they were doing. They had similar amount of movement in all 5 conditions. Lumbar spine shifts, again, very, very similar. Standing, we're getting the most adjustments. There's a pain response here that helps drive this. But in our hybrid, they're not moving any more than a reference chair. Okay. So at this point, we kind of scratched our head a little bit and said, what's going on? And this is where, I thought of this on my motorcycle. I was out driving, and if you look at the pelvis here, it's really constrained by the seat, right? So this is not published. It's a one of, it's a future direction that we'll be pursuing in the lab. But we have a bunch of these devices around, and the order of the images across your screen align with this graph. Okay, so traditional sitting with the 90-90-90 angle. This is a core stool. This is a Sally stool. This is the focal upright, or lotus, I think they're calling it now. This is the Bombax stool, and then we have stand to benchmark these. And so you can see that first, if we look at the trunk to thigh angle here, all of these fell, right? Sitting is between 90 and 100 degrees. These are our 4 open thigh angle, and they run from 125 to 140 degrees. So right around that 135 benchmark that we're trying to look at. The lumbar position, so extended and flexed, becomes more flexed in all 4 of these than sitting on a normal chair. And this is because of the pelvis angle becoming more flexed and rotating backwards, just like I thought about on the motorcycle here. So even though we're trying to open this to drive the pelvis, we're not getting a drive through the pelvis, which is not translating into a change in lumbar spine posture. Okay, so at this point, we kind of paused a little bit, tried to change gears, which is what the schematic or 2 pictures refer to, and then just had this question of, when we're changing height, are we actually mimicking the natural sit to stand movement in the lumbar spine and the pelvis? And that's all this is it's showing, we start with people sitting. Let's start up here. So trunk to thigh in blue. We start with people sitting at 90 degrees. They initiate a start of movement. It actually lean forward. So think you're closing that angle a little bit as you lean forward to stand out of a chair, and you get to stand and you're at 180 degrees, or 0 in this case. And then you go back to sitting. And hip and knee are shown here, but what we really care about are the pelvis and lumbar spine. So you can see in natural standing, as soon as I start to stand up, my pelvis starts to rotate forward. And my lumbar spine, oh my God, sorry. My lumbar spine, as soon as I remove seat contact, it is also linearly returning back to my neutral spine posture and standing as soon as I leave the seat pan. So just a couple modeling demonstrations here. What you're going to see first is natural standing, and see how the pelvis rotated as soon as they started to stand. And then the middle one you're going to see sequence next, and it is that study where we went from 90 to 180 degrees, and watch the pelvis. The pelvis actually doesn't come back until there. Okay, so when they're sitting, it's rotated, and the seat pan is maintaining that pelvic angle because the hip's opening, but the pelvis isn't rotating. And then the last one I won't get into, but it was constrained standing, where we thought maybe it's because of the trunk, and if we have people maintain a vertical trunk as they stand, so a controlled stand. But you see the exact same thing. You see the pelvis rotating right out of the gate, even in constrained standing. If we look at these graphs, and they're a little odd, because you're probably saying, why don't these match up with the pelvis angle when they're sitting? And it's because this graph is from loss of contact with the chair. Okay, so you have that phase where they start to stand, and as soon as they leave contact with the chairs when they were in the 90-degree position. And you can see there's a dramatic difference in the pelvis between these, both of our dynamic or free movement from sit to stand, and putting people in static positions trying to mimic those postures. Okay, so the pelvis doesn't rotate at all because of the constraint of the pelvis. It freely moves when we dynamically go from sitting to standing. And the same with the lumbar spine here, right? It doesn't start to return back until we're well out here, again, for females in that 145 range, males 160 degrees to approach zero, but it's very linear when we're freely moving. Okay, perfect, right on time. So we have this 135-degree idea that doesn't really seem to be holding when we look at sitting. So then we started to look at what is the passive response of the spine. And the way we do that is we take people and they're put in a jig here. Their lower body and pelvis is all fixed, and this part of the jig moves. So we isolate the lumbar spine, all the tissues around it. They're told to relax. We measure muscle activity to make sure muscle's not coming into play here. And they're pulled through flexion and extension. And where the moment is very low across a range, we have that neutral zone that we talk about, where things are in balance on flexion and extension, or posterior and anterior side of the trunk. And what you see is we have a range of about 20 degrees of neutral zone, both males and females. What this black triangle shape is the lumbar posture in standing. So you can see in standing, we're right at the tip of it. So some flexion, if we flexed people, we would get into that neutral zone. So again, the idea of 135 degrees of bringing people into some flexion should push them into a neutral zone. If we look at where this neutral zone occurs relative to trunk to thigh angle, in females, it's actually between about 140, 145 degrees and 160. In males, it crosses from about 130 to 155, 160 degrees. Recall from the Keegan study, that 135 degree came from a male. So right away you can see females don't have the same position of that neutral zone relative to the trunk thigh angle. I apologize, but it's going to get more complex in a second as well. So lumbar posture and upright standing is the diamond. As I mentioned, you can see it's outside of there. And you should also notice again that the 135 degrees appears to be outside the neutral zone, especially for females. Okay, so this is important. There's a lot going on here. I'm going to try and direct you to why I think this is a really critical piece of information. So we took the first study I just showed you. This is the position, let's call it close to stand or standing, with a straight hip angle and pelvis. Then we brought people into sitting, fixed them in this position, so the pelvis still can't rotate now in the fixed position, and then looked at the passive range of motion. Okay, so we're perturbing them here, looking at the neutral zone, but held in a sitting position and held in a standing position. The first part should make sense. Doesn't matter where I have you, you have a biological neutral zone that's dictated by the passive tissues. So you can see sit and stand, there's a little error here that, it moves a bit because of instrumentation, but the size of it is very similar. Doesn't matter where you're sitting and standing. What these four symbols are the lumbar postures that you exhibit or the people exhibited in stand, sitting in the 90-degree posture, sitting in a 135-degree posture, or side lying. And you can see that 135 degrees actually falls outside of this neutral zone, no matter what dimension of measuring neutral zone we use. Okay. The other thing that's interesting is depending how you measure neutral zone, it changes where it is. So if we look at it relative to the sitting posture, it is between 105 and 135 degrees, which starts to match some of the stuff we were seeing in sitting. But if you look at standing, it's very close to standing. And this is just a summary of how many people had postures at 135 degrees that fit in the neutral zone. And you can see it's very few people when you put them in 135 degrees that they fall into the passive neutral zone of the spine. So if you're like me at this point, you go, what is going on? So this animation is hopefully going to help a little bit. And one of the problems with this trunk to thigh angle is it's not a joint. It's not like your elbow joint where if I move my forearm and my upper arm relative to each other, that elbow joint, if I put it at 135 degrees, that's repeatable if I bring those two segments back to the same position. Between the trunk and the thigh, we have at least 5 spine joints. We have a pelvis that rotates, and we have a hip joint that's not shown on the diagram. And we're looking at this a little bit. There's a new study coming, but the flexibility of the hip here, to drive the pelvis, you have to take that hip to a point where it has a passive force that will pull the pelvis into position. And you can do this yourself. I'm standing right now, but I can move my thigh on my hip joint and it doesn't force my pelvis to move until I get to end range of motion, right? Until there's something, a ligament that is pulling on the pelvis to force it there. So when we go to sit to stand, the other thing this shows is here we're getting the passive motion. We load the pelvis backwards, these joints flex, and you still have passive motion. It's just redistributed in the spine different. So all of these things are coming together that I think are impacting when we're trying to open the hip joint. It's not directly fixing or giving the lumbar spine a more beneficial posture and rotating the pelvis. All right. So coming towards the end. So hopefully there's fans Back to the Future. So we're going back to the future. Back to sit to stand rotation, okay? There was a meta-analysis published in 2018 by Carissa Harris-Adamson's group in California. It looked at a whole bunch of studies that were published up until that time and showed there was a net beneficial response. If you had sit to stand stations that were used, you would impact low back discomfort. So a net reduction was found across these studies. So this study was using a new device, Movably. We did a study for them. This is it here. The seat pan drops out of the way. One of the big problems with sit to stand stations are lack of usage. So I get these calls all the time. You're practitioners, I'm sure you see it, where you have these stations and people aren't rotating between postures or are not rotating in a beneficial way that is impacting them. So this is an automated response where you're at a workstation, these seat pan components drop and you're standing. You don't have to change anything with the workstation and you go from sit to stand almost immediately. So again, we use 2 hours of exposure in 5 different conditions, controlled tasks again, and a very high rate of sit to stand because the transitions were very easy. So every 3 minutes we rotated between sitting and standing. The other part that's not on this slide, but we'll get to, is we had a subgroup of people who were pain developers from standing. So that impacts how much they can actually stand at work anyways. And what we saw from this was actually some pretty neat things. Simple stuff first. The sit position of sitting in this chair at a high level was the exact same as sitting in an ergonomics chair at a lower desk. So you see no difference in pelvis posture on your left, lumbar posture on the right. So sitting was sitting in these devices. Standing is the reference. And again, you can see we have the anterior forward tilted pelvis. Can't say that word today. And standing immovably, though, was different. Come back to it in a second. And if we look at lumbar spine motion, also different. So now all of a sudden we have something that is truly hybrid between standing and sitting. It's in between these two, okay? And the same here for pelvis, okay? Where it's less rotated than in sitting, but forward rotated into that neutral zone in what we call standing. So what impact did this have? Well, what we found, and it wasn't intentional, but it's just how people ended up using it was this lean posture. It wasn't true standing. They could stand if they wanted, but they leaned, which caused that change in posture. So that put them effectively out here, which was in our favorable zone for hybrid postures. So they're sitting in between, or standing almost, leaning between 170 and 180 degrees. I want to talk here first, non-pain developers. It didn't matter if they were sit, stand, or using this device. They remained pain-free the whole time. These pain developers who are acute transient pain developers in standing, when they rotated between sitting and standing, they became non-pain developers. In fact, they had less pain reported than when they were sitting, which is a very strong response. And then from a productivity standpoint, okay, this is a bad one, but males were less productive than females. Not sure why. Standardized tests, everybody was doing the same. Pain didn't impact them, so it didn't matter if they had pain or not. Their performance was the same. Females in standing, where they developed more pain, were less productive when they had pain. And as soon as we brought them into conditions where they didn't exhibit the pain response, so as I mentioned again, we shoved them down here from reporting pain to not reporting pain, there was no significant difference in productivity. Okay, so last slide, some takeaways here. Where do we stand with this? I know I've thrown a lot of research at you, a lot of information about what these devices are trying to do and what they are or are not doing. But currently, based on what we've looked at, the devices that we have seen assessed, they do not de facto induce better low back posture simply by opening the trunk to thigh angle. And hopefully you have an appreciation that that's because there's a lot going on in there with the hip joint, the pelvis rotation, and the lumbar spine postures. Probably not viable right now is a one-off workstation seating solution, so don't get rid of a chair and get one of these. They tend to create higher discomfort at the higher heights where we need to get people to change or effectively change the posture. Okay, you saw that with the discomfort ratings versus actually changing posture. When we get people to where the posture is changed in a more beneficial direction, they're less comfortable. If they're fully adjustable and you can go from a seating to a hybrid height, they could be a single solution. But even then, there seems to be something going on there that they don't perform equally across those. And the achievable postures which we see as being favorable are around or below 120 degrees. And again, those don't induce changes in the lumbar posture or pelvis and are linked still to discomfort. So again, back to the future, sit to stand rotations seem to be a more sound solution based on the gross postural changes and good job rotation practice. Likely have shown some benefit from a health perspective because you're mitigating the fixed exposure in sitting and the fixed exposure in standing. And the point I brought up earlier about these hybrid devices, are they any better really than sitting or standing in isolation if we just put people in a new static position? And that's really not known. Okay, so there's a lot of benefit around moving. This leaning solution seems to at least address the postural constraint differences. Some of the concerns there are things to keep in mind as practitioners is they tend to be large format solutions. So and by that I mean they take up more landscape. They have been shown to provide a benefit in pain reduction. They can create postures aligning with neutral zone measures, but can be cumbersome to enter in position. So to get them set up with your desk or to move them if you want to stand or do something else, they tend to be bigger. May not accommodate all desired postures, so some of them may accommodate lean but not sitting. And the long-term outcome of using these. So leaning, again, the same with hybrid seating. If you have leaning, the impact on health outcomes are unknown. So do they align with sitting or standing, or are they more beneficial and mitigate those two extremes? A lot of what I've talked about, there are some resources at the MSD prevention guideline website. This is poster 6 from the office guideline that goes through sitting, standing, and on the back of it talks about some of the movement benefits and how you should coordinate sit to stand. And I'll stop there, and I'm happy to take any questions.
Thank you so much, Jack. What a very interesting study and a lot of data for us to consider. And I'm now standing as I'm going through the questions, and we've got a lot, so we'll see how many we can get through. I just wanted to start when you were presenting that we had a comment that the HFES 100 does not give recommendations for perch stool and products.
Yeah. So in the last version of, I think it's 2007, you're absolutely correct. It doesn't. There's a draft version in place that they've been working on, and it does have them, unless you, whoever, Lauren, if you know that they have released that version, I'd love to hear from you, or if you've seen a newer draft where they've removed them. But they were quite keen on incorporating these in the newest one that's coming.
So great, it's coming. Jack, any studies that showed impact on knees?
Yeah, I didn't really focus there. There are studies, we looked at them as well, and you do get some benefit. Some people have shown some benefit on the knees in these hybrid postures from standing. But on the other side, we've shown that the demand at the knee is much higher than sitting. So there's a comparison issue here of it's easier on the knees than standing, but depending on how you offset these shear forces, you could end up with more load on the knees. So
Okay.
that's a hedged answer, I guess.
Well, and that helps with the next question. What would you recommend for people who are having problems with feet and ankle swelling?
Yeah, so those are two different issues,
Yeah.
unfortunately. Um, the simple problem with, or the simple solution for feet is sitting down, but we know that often when you sit down, you can get increased edema, right? Swelling
Swelling.
of the lower limbs because you're not moving the same and you don't have the same muscle involvement of swaying and standing that returns blood volume. So I, I honestly, like, I come back to sit to stand, and anything that can get those people moving in an individualized pattern that accommodates where their discomfort is coming from.
And Jack, going back to the motorcycle, is there any benefit to the adjustable saddle chair?
Yeah, so this was a shocking finding, and that's the study that I have to say there was only one subject. We just kind of pulled somebody in because we had these questions, and the plan right now is we're trying to launch a full study with all of those. But the Sally one I showed you is a saddle chair and the bomb back. So those are chairs, a bigger seat, kind of almost horse seat-ish, in between a horse seat and a bike seat, where the legs are spread on either side of it. And I actually thought those would have a pelvis rotation, and they didn't exhibit it. But again, it's on one person, and it's something we need to look at in more depth. So right now, I don't know. So I don't have enough data that I'm confident of saying there is or there isn't a benefit, but I have more questions now than I did beforehand because I
Could be an
thought there would
interesting
be a
small
rotation.
seat grant.
There we go. And the other issue with that is a very practical one that females don't tend to like sitting on those, especially if they're wearing a skirt or something else. So there's a practical barrier for implementation in certain settings.
Okay, and armrests. So in the middle illustration, if you can remember back to that one, are the armrests being used to stand and are the feet fixed?
I don't know which one we're
So
talking about.
that was
Sorry.
at the very, close to the very beginning. You had the three illustrations. We'll come back to that.
Yeah. So they
Yeah.
don't actively. You can. So that most of these devices have locking casters that when there's weights on them, they don't move, obviously for safety reasons. So you can assist yourself egressing and ingressing the chair by putting weight on the chair. But when we're putting people in these positions, no, they are not supported by the armrests. So I don't know if that answers what you're asking, Lauren, but if not, please email me or follow up in the chat there.
Okay. Comfort for a lower back injury can be found by, this is interesting, putting out a desk drawer and raising one foot to rest it on
Yeah.
the open drawer higher than the other foot. Is there merit in twisting the pelvis by having each foot at a different elevation?
So, okay, a lot to unpack there, Ken. So raising a foot definitely works. We've seen it. What it does is it takes the standing position of a forward tilted pelvis, a lordotic spine, and brings it into neutral. We've published a study on this and shows it changes pain perception by using a footrest. We've also shown by using a footrest in different cycles, it can break up people's responses who get pain from standing. The twisting of the pelvis, I would have concern about. We're looking at this a little bit with that movably study I showed you where they have a position we kind of call the flamingo position where one leg drops. So you're standing on one leg, but you have a high leg, I think like you're talking about with a desk drawer. So like really the hip is almost at 90 degrees. And we're trying to feather out what that does to the spine because we know the spine is most responsive to flexion. It's strongest in that dimension. And the risk of off-axis movement there for developing pain is much higher when you bring in lateral bending and axial twisting. So that's my hesitancy around that component of your question.
A lot to unpack there for sure. Would you expect to see similar results, increased leg muscle activation and more hip flexion for individuals using lower body exoskeletons due to potential changes in lower limb support along the length of the legs as opposed to just at the hips?
Oh, come on, James. So it's good to hear from you. Nice to see you here. Um, I hard to answer definitively. It depends what the exo is doing and what position you're putting them in and how much support they're getting across the three joints. So if you're thinking of the one that is just like the little seat stool that drops out from the exo when they're sitting, that is depending, I think, predominantly on the user. So I would expect to see similar responses. If you're talking active, where it can control the joint and carry the load of the body, then with a trained user, I would expect to see lower responses.
Hey, Jack, I'll try and hurry up between the last few questions. I'm not sure what this one is trying to say. Did you make ergonomic using a treadmill?
Uh,
People moving with standing
yeah,
posture.
we haven't done it. There's a lot of work published about this. There's, in fact, every study I've read or reviewed has had an accident involved in it where people have come off the treadmill. So there's a safety risk, in my opinion, around this. And the metabolic change at the rate that people walk on them is very, very low. So, probably getting myself in trouble, but in my eyes and based on what I've read, you're better to step away from the office and go for an active walk. You will get much more out of that than trying to use a treadmill at a desk. And
Not
I
safe.
will also echo Salman Malik's comment, Happy Women's Day.
Oh, that's great, Jack. Thank you. For the leaning posture described at the end of the presentation, were there findings related to forces on the feet, similar to what was shown with hybrid seating that related to some of the discomfort?
We haven't. So we haven't looked at the shear forces, and mainly because of this large format issue where there is a continuous bottom plate to maintain the structure of that device. So we would have to come out with either a cutout or some way to measure the force under the feet. But based on the very positive discomfort ratings, I suspect it's low. That most of the vector for the force, if you picture that, it's still so close to vertical that it's almost dominantly in compression. I would expect very low shear values there.
Okay. And James again would like to know, was the backrest angle in the movable adjustable when standing, and would this impact the perceived level of pain in pain developers?
Okay, so now I'm trying to remember it was fixed in the version we had, but you can move the whole thing. So when you were standing, that whole device moves up and down. So you could adjust where it's supporting you in standing. And they have a newer version, I believe, that the low back support is adjustable specifically separate within the seat back pan. Would it impact pain developers? I I don't know. I don't want to go too far in speculation there.
Okay, we're going to end on this question since it is International Women's Day from Nancy Black. What happens when opening the thighs laterally? Has this been considered?
Hmm. It hasn't, Nancy. Good question. I think two things I think that you'd need to consider there is one, it's probably not a preferred posture for people to stand in, and it induces lateral shear into the feet. I had another thought that's escaping me. Crap. But I'm happy to email with you, Nancy, if you want to send me a note. We can talk about that. Oh, the other point was we've seen big differences in pain developers in lateral shifting movement. So when you have people standing, the ability to shift center of pressure, center of mass, medial lateral alleviates pain. And I think if you lock them in with wider foot stance, you may mitigate that or reduce the ability to do those weight shifts.
Okay, I want to thank everyone. This has been a fantastic presentation, wonderful engagement. And for those of you who didn't get your questions answered, we will put the questions and some bullet point responses to those answers on the events page when we share with you the recording and the PowerPoint slide. Thank you so much for joining us today. And again, if anyone has anything specific that they want to share or ask Jack directly, please don't hesitate to do so. And we look forward to seeing you in the very near future. Thank you and have a wonderful day.